Convention on the Rights of Persons with Disabilities. So thank you.
Okay.
Professor Danius, ملاحظاتك في منتهى الأهمية والتوصيتين.
Professor Dinus, your recommendations are very valuable, and of course we will give them more attention in the discussions. Maybe you could tell us more about moving from institutional services to community level services. What exactly do you mean by this, and how could they be implemented? And of course, we see a lot of officials that are ignoring a little bit the psychological problems and the mental health problem. Mrs. Nahla, we go back to you.
دولنا ما تنظر له لأنها مش شايفة قديش في أبعاد اقتصادية الاكتئاب
Depression, the fear and reluctance have several repercussions, economic repercussions, and we need to have studies to highlight to what extent the psychological situation affects the economic aspect so that they care about it. My objective in this intervention, based on what the special rapporteur mentioned, Mr. Puras, about the community level. In the community level, the role of women is essential, very central. So we need to know that she is a change maker, and it should be moved from the perspective of victim to the change maker. She's the one who can see the manifestations when better empowered and equipped to deal with the psychological health for the elderly, the children, the people with special needs. We make her more able to reduce the burden of such a distress while we achieve environments with governmental policies with essential resources. The resources are very important. The WHO had launched a big study about the impact of the COVID-19. And as I said, in our region, we don't only have the COVID-19, we have the armed conflicts, the economic deterioration, the lack of political stability. All of this together create further tendencies towards psychological breakdown. So the first respondents are women and girls at home. How to foster their capacities, how to empower them to deal with such a thorny issues while waiting for the policies would be at least protecting our societies. Thank you very much. I had around 5 minutes, but it was very divided. I hope that you got the message. No, you were clear enough. No worries. And I urge you to take part in the interactive discussion as well. The role of women and the community level is very important. Professor Danius mentioned that we need to start working at the community level. We need to move there because with the multiple roles of women, we can say that women are a school, women are an institution, as mentioned in the old sayings. And she's really the valve for the psychological situation. And sometimes states do not have the reach out that women enjoy. Another important point is the measurement of the situation, how to convey the outputs to the policymakers and the decision makers for further action. Now we move to Dr. Abdul Hamid bin Abdullah Al-Habib from Saudi Arabia. He's the head of the Psychological Center, and we're interested in getting his insights from a governmental perspective. The floor is yours, sir. Peace be upon you. Good morning, everyone. I'm pleased to be with you with such a great group of subject matter experts. I'm here to share with you certain ideas about the impact of the COVID-19 on the psychological health. Let me start with a positive note. How can we have a better impact to reduce such a distress? The stability, the comfort would further allow us to overcome the crisis with the lowest damage. And here we need to address the decision makers and policy makers. We need to tell them that fostering the psychological health would allow the people to overcome problems. And we know that when a community gets together, when there is collective action, the impact of the crisis is reduced. Undoubtedly, the language that is used is very pivotal. It must be direct, clear, and transparent because it enables a better psychological health, having a credible source of information that tells the truth, that explains to the people what needs to be done, that conveys the right messages, keeps asking questions, and gives advice. Those are the basic rules for addressing the audiences and the public in times of crisis. Unfortunately, a lot of countries were not able to get the proper message and were living in worries and fears for around 2 years. And we know that the psychological health is highly vulnerable to the economic and health conditions, other surrounding settings. So any external factor would push us into a psychological distress. And for the first time, all societies across the globe are faced with the same crisis. Usually it is one group, one country that is faced with this risk, while now all societies, all communities are going through the same crisis. What is also surprising is that in all previous crises, there used to be a group who's able to do it, while now the health workers are the first respondents are the most vulnerable in terms of the overload, the fears, their requirements. So this crisis is the first of its kind, and our tools must also be unique and different in all dimensions. The aid tools must be developed. As psychological health experts, we do not have such an expertise, and we need to provide the society with something where we don't have previous experience and backgrounds, and this is unrealistic. We need really to assess our capabilities and abilities in order to allow the societies to overcome the crisis. We might be too ambitious in certain cases. The skills and competences do not accompany the level of the crisis, in my opinion. We need to see what trainings must be provided to the respondents, and we need to take accelerated actions in training first respondents to see how they can really care for the psychological health in this region of the globe. In this part of the globe, we're not only faced with COVID-19, as already mentioned, we have conflicts, wars, and instabilities. There were several attempts to highlight the current psychological situation in the Arab world. There was a study with different Arab countries that highlighted a big impact on the psychological health. It was really serious in the low income and middle income countries, to a lesser extent in rich countries, although everyone is affected to a large extent. Prior to this pandemic, we didn't have any measurement tools for psychological health in this part of the world around the Mediterranean basin. And we cannot say whether we got affected or not, but the direct experience and the large demand on the services really shows that we're going through a real crisis. Having a technical team that is capable in the region really helped alleviate the crisis. It helped. It didn't reduce it totally, but it did help. But unfortunately, the most vulnerable are those who have the lowest access. So it had a limited impact. We need to have the technologies and really promote technologies in the future. That might be a success tool for the future. let me share with you a small experience whereas we tried to monitor the effects of the pandemic. A quick survey was conducted with 16,500 Saudi citizens between May 2020 and August 2020. We used the Q line in order to assess the respondents. 15% of the Saudis are vulnerable to depression. 12% are vulnerable to a lower level of depression, which goes beyond the national average, the usual national average. The elderly and the people with special needs are the most vulnerable. Also, the suicide attempts were high during that period when the survey was conducted around Saudi Arabia. Actually, we are in dire need to reassess our capabilities in terms of providing assistance. The experience of the psychological experts have never dealt with such issues. I think that compared to other health sectors, we have the lowest experience in terms of dealing with crises like this COVID-19 pandemic. Thank you for your attention. Microphone, you're muted, sir. Microphone, please, Ibrahim. Conventional means are inappropriate. So what do we need to develop the appropriate tools? This is an important question that we need to ask. During the dialogue, we learned that in a country like Saudi Arabia, unfortunately, you're faced with situations that are very similar to other countries in the region. How do you perceive this cultural barrier? What are the solutions? What are the tools? And that's a big question now, because we are very much committed to the time. We will move to another interactive session, and I urge you please to limit yourself to 2 minutes so that we're able to get back to the keynote speakers in order to respond. Michelle Haddad from UNDP, are you with us? 2 minutes, please, Michelle. Mr. Ibrahim, I'm sorry for the interruption. Mrs. Sumaya Mradi with us in the second session for people with special needs. All right, in this second session, we will focus on the people with special needs in particular. And first, we have Mrs. Sumaya Amrani. The floor is yours. So mental health for persons with disabilities, the floor is yours. Good morning, everyone. Thank you for organizing this session. Greetings to everyone. With regard to my intervention, I'd like to confirm that the right to health, according to the International Covenant on Social and Cultural Rights, identifies the right to the drinking water, the housing, the safe environment, healthy environment. The pandemic showed that a large number of people, especially people with disabilities, didn't have access to this right to health, in particular the right to mental health. Let me mention 2 studies conducted in Morocco about the impact of the COVID-19 during the lockdown and on people with disabilities in general, as well as a study on the domestic autism. Both studies showed that access to data is very limited in terms of the different disabilities. difficult respect of the precautionary measures, the lack of a governmental plan for emergencies that takes into consideration the needs of people with disabilities, the lack of the livelihood and living sources, especially for those in vulnerable families, the difficult access to data about people with disabilities who are COVID-19 positive due to the lack of databases and synchronization with databases about cases and deaths. And domestic violence was highlighted as well in such studies. Those difficulties affected the health and physical, the mental and physical health due to the fears, the lack of readiness of the health and medical centers to receive people with disabilities who are affected by COVID-19. There were fears, concerns, and worries amongst the societies. In addition to that, the lack of stability with that burden. A lot of people have lost their support networks like family members and friends. Psychological and social isolation increased with the digital divide that increased the gap between people who have access to the web and others who do not have access to it. In addition, the pandemic had affected the access to mental health services. Thus, we can say that it is high time to take into consideration or to confirm the importance of Article 11 on the Convention around people with disabilities in order to guarantee the safety and health of people with disabilities, in addition to integrating the disability aspects in governmental plans for the implementation of the mechanism on disasters, in addition to apply mainly Article 11 of the relevant convention. As mentioned by the recommendations of the Committee on the Rights of the People with Disabilities, all programs targeting people with disabilities during the pandemic must be based on inclusive health systems that guarantee access to everyone and that provide health and mental health services in general based on the active participation, equality, non-discrimination, inclusive access, personal freedom and safety, the consent and the non-harassment. And it must be said that COVID-19 is an opportunity for all of us to reconsider health systems in general and mental health in particular, as well as working on the restructuring based on human rights that respects the informed consent principles and health rights. And here it turned out to be very important to reconsider the legal aspects, regulations around people with disabilities, to what extent they're able to express themselves, take decisions when it comes to treatment, rehabilitation, and health services based on Article 11 on the Convention for the Rights of People with Disabilities. Another point that was highlighted lately is the need to reconsider the health and social intervention mechanisms for the people with disabilities and the young through the mental health services based on health instead of providing medication and medication that would affect the physical and mental health of people. And it turned out that this is an opportunity for the countries to reconsider the supply of services and the mental health and to invest in human resources that are well right-based equipped in a way that guarantees support against isolation and the free decision making. So as already mentioned by the colleagues, now it is crystal clear that we are called to reinvest in the databases and detailed information about people with disabilities, especially the most vulnerable, i.e. women, children, migrants, and other groups that are at risk of discrimination, to as well reconsider the funding indicators and targeting of people with disabilities, in addition to guaranteeing the safety of people with disabilities and taking all measures in order to provide them with support, getting them out of the isolation centers, and provide other medication that are essential for the people with disabilities, house care and support in a way that would guarantee their dignity and access to all services. I hope that I was right on time. Thank you. Thank you very much, Mrs. Sumaya, for sticking to the allowed time. And that helps us reach the final recommendations, and we identify 3 points. First, the importance of information collection. Previous interventions highlighted those points: the lack of information about people with disabilities and the early intervention mechanisms, whether that's part of the governmental policies or not, and the medication support. You know that the medication intervention has a lot of impacts, and we need to start early with other means. A quick note to myself and others, please let us be speaking slowly for the sake of interpretation, as mentioned by Dr. Ibrahim. So there is difference between the pandemic affected governmental intervention and the private sector's intervention. So I would like to ask, what are the non-governmental entities or the most effective in terms of access to people with disabilities, and what are the support networks that you can perceive how to really reinforce such roles? Non-governmental entities and governmental support entities. Now I give the floor to Dr. Bassel Tarauna, Vice President of the Supreme Council for People with Disabilities in Jordan, and we're interested in getting a governmental perspective at the core heart of our topic. Dr. Bassel, the floor is yours. Thank you very much. Thank you, Dr. Ibrahim. Greetings to Dr. Baha and the role of the OHCHR in terms of this highly important topic, especially when it comes to the rights of people with disabilities. First, I'm sorry. I thought in the beginning, I thought that it's an evening meeting. I wasn't fully prepared to be with you at this hour and to be up to what is needed for this session with such people who are interested in knowing what is the situation in terms of people with disabilities. In Jordan, like elsewhere, the pandemic hit us hard, and as a Supreme Council on the Rights of People with Disabilities and as governmental institutions, together with CSOs, we've always been working in order to achieve the noble goals for the people who are the most at risk of violations. The Supreme Council, from the very first week of the start of the pandemic in Jordan, we had very low level of cases, 3 or 4 cases officially acknowledged per day. However, the efforts of the Supreme Council were clear. Hotline numbers were made available for communication with the Supreme Council. The Supreme Council as well dealt with other entities. In 2014, a new law on the rights of people with disabilities was passed and promulgated. It forces all institutions within their competences to really provide people with disabilities rights and human rights in general as a priority. So I think that despite this difficult, confusing situation, the Supreme Council was able to work hard. Cases started to grow increasingly high with the spread out of the pandemic. In addition to the actions taken by the Supreme Council, there were examples that can be replicated by the CSOs and by the INGOs that are operational in the Jordanian territories. They've played a crucial role that cannot be neglected in supporting the Supreme Council's efforts and the governmental experts in general. Because as you all know, we have a big and a large a number of refugees from a humanitarian perspective. They are the most vulnerable and the most at risk of violation, especially women and children, as well as old people with disabilities. They were the priority in terms of the services and in terms of networking with all governmental institutions in order to reach a certain minimum level of support, at least. I must say as well that the circulars by the Prime Minister were really in harmony and very consistent with the civil society's perspectives, namely when we speak about escorting people with disabilities or supervisors and caregivers, as well as parents, family members had paid leaves in order to cater in a better way to the needs of people with disabilities, audio, hearing impairment, sight impairment, and other types of disabilities. Of course, that was a complementary support effort. We might think that today we've had lessons learned out of this pandemic and that they must be really incorporated into our policies, legislations, practices. Undoubtedly, we need to take that into consideration because we're committed to the rights of the people with disabilities from a religious rights and social perspectives. That is something that is guaranteed through the governmental entities and pioneer civil society organizations that supported the works of the caregivers and family members of people with disabilities, in addition to administrative actions. Logistics, legal facilities were made available to protect the rights of people with disabilities as a priority on the agenda of the state. That is, of course, the duty of each and every country. Such a group of people must be given a priority, especially that we've issued a quality law on the rights of the people with disabilities that really had details about all of the possible efforts supporting and assisting the rights of the people with disabilities in the different sectors, namely during a crisis. And it's a serious crisis that the entire globe was faced with, and that the Jordanian society was highly affected, with the Supreme Council presided by the Emir, by the Prince, is really deploying exceptional efforts, but we are in need of further actions and support in this regard. Thank you very much for your attention. Thank you, Dr. Basil. You mentioned lessons learned, and that is exactly what we're looking for in this conversation. And your inputs also highlighted important aspects. How to foster the family, how to have a greater support, because when there is a big split between people who support and others who do not, the role of the people around the person with disability is important. Is it part of the lessons learned, or their programs for the caregivers, for the family members? And that is very important. Let me now ask you all to move to the interactive part. I will I have already Mr. Michel Haddad. 2 minutes, please. And then we'll have an full interactive session. All right, thank you very much. I'm Michael Haddad, UNDP local ambassador, but I was asked to speak a little bit about Lebanon. Thank you very much. Thanks for your inputs. As we all know, now we're suffering from a mass trauma because of COVID-19. People with disabilities are those who are the most affected by these consequences. In Beirut in particular and in Lebanon in general, we are suffering from additional repercussions, the serious economic situation and the second large explosion in the world. Very quickly, let me tell you about the situation in Lebanon. People with disabilities in Lebanon now are not capable of having access to the basic supplies and necessities that would enable them to live and keep on getting sustained. And I'm not just speaking about the Lebanese people with disabilities, but that also applies to other people with disabilities, because Lebanon hosts a large number of refugees, Syrian and Palestinian refugees. We have millions of refugees. To make a long story short, that is our main issue. Most importantly, let me now highlight solutions. International platforms, governmental platforms are open, and they allow such groups of people to have access to the basic needs. I mean vaccination services as well as services during lockdowns. And in Lebanon, with the lockdown, the platforms used by the Lebanese government were not equipped for people with disabilities, and the COVID vaccine platforms are not sensitive to people with disabilities. In addition, the devices that would allow the person with disability ask about his or her situation and access available by the country or international organizations for the survival of the person are not really people with disabilities sensitive. So let's say now we are beyond COVID-19, but we have big problems. The international community tell us very nice stories, but we are in a particular situation. The bridge, the link between the services and people with disabilities is not there and is not equipped. When I say it is not there, I mean it's not equipped for people with disabilities or people with special needs, because they are both in the same category, in the same situation. In Lebanon, we are much more affected. And even if we want to speak about radical solutions, we need to see how to make the services available to others and how to go for an advocacy, how to tell people, especially this group of persons, how to act or how you must act in cases of problems. Thank you.
ماهية الجسر في توصيل الخدمات، تواجده من ناحية وتأهيله من ناحية أخرى، سؤال في غاية الأهمية وبيعيدنا لقضية.
Thank you, Michael. This is a very important question regarding finding the link between different services, and we'll go back to this idea now. Dr. Khalid Saeed from WHO, the regional consultant for mental health. Dr. Khalid, you have the floor. 2 minutes, please. Because we need to go back to all these points. Dr. Khalid. So if he's not ready, we will move to Mrs. Ola Abu Sukkar. Good morning to all of you. I'm very happy to be among you today. I would like to talk about mental health. We have Mr. Abdel Hamid Ben Abdullah Al Habib, who is one of the most important specialists in mental health. And our center is one of the most important centers on mental health and training on mental health. If I were to talk about the efforts deployed by the Kingdom of Saudi Arabia in dealing with COVID-19 pandemic, I would need longer days because we ensured equality between nationals and non-nationals, and we conducted all necessary interventions and provided all necessary support. King Salman directed or ordered us to mobilize all efforts in all ministries, especially Ministry of Health, in giving persons with disabilities all attention and all relevant care. As for the Ministry of Education, in the past there was no real support given to online education. But later on, we ensured relevant platforms for fluent interaction between teachers and children. The efforts of the Ministry of Labor were also very considerable because the ministry helped all stakeholders in providing them with all necessary support as not to lay off any employee, including persons with disabilities and people who could be exposed to poverty and unemployment. I'd like to move to the efforts deployed by the center and other stakeholders in the kingdom. An electronic platform was established to provide online trainings, and we focused on the ways families could deal with the children and the persons with disabilities. And I mean by this different disabilities, because as you know, mental health is different from, for example, hearing impairment or from learning difficulties. So all relevant trainings were given in order to provide proper training to teachers. We forget sometimes that children with disabilities need the support of teachers, because teachers are women and men, fathers and mothers, and they are under mental and psychological pressures, especially in dealing with this new way of learning. So all our online trainings were totally free of charge, and thanks to these trainings, we were able to register a big progress and improvement. We focused as well on global and comprehensive access to services. Let's suppose that a person with a physical disability has a special assistant, and because of the pandemic, this assistant could not come to that person with a physical disability. We provided through the center a training that gave specific figures on the ways to deal with such a disability. Dr. Ola, we lost you. Please be brief, because we still have only 20 minutes. So please be brief in stating your remaining points. Dr. Khalid Said is back with us. So please 2 minutes, and be brief so we can conclude. So if Dr. Khalid is not available, we move to Mr. Annabi from Palestine. Mr. Amin? Thank you, Mr. Ibrahim. Thank you, Mr. Baha. I think that the issue of COVID-19 pandemic is not specific to one country. It affected the different sectors in the world, but maybe marginalized families, poor people, and persons with disabilities were the most affected by this pandemic. In Palestine, I do not think that our situation is different than the situation in surrounding countries. But of course, in addition to the pandemic, we are still suffering from the Israeli occupation on the Palestinian territories. Nevertheless, there were governmental and community-based initiatives to deal with the pandemic with a special focus on persons with disabilities. According to the social map in most of the countries, persons with disabilities are marginalized and are not given due care and attention as other people. But in Palestine, and since the beginning of the pandemic, we provided medical services to persons with disabilities. Of course, there were some difficulties in responding to their needs because such needs required a specific procedure and specific measures, which used to create some problems within persons with disabilities. For example, we couldn't implement social distancing because a lot of persons with disabilities needed people to help them and to assist them. And some organizations were lacking medical supplies or food assistance, and they couldn't even pay for the salaries and wages of staff. In Palestine, there were efforts deployed by the private sector, which played a very important role in responding to these needs, in addition to international aid and assistance provided by UNICEF, UNDP, World Bank, and the European Union, the contributions of which were considerable to provide care and attention to those categories of people. And of course, we are in front of big challenges when we talk about people with disabilities and the COVID-19 pandemic. We need training. We need some specialized people, and I think that among the recommendations of this webinar, we could state the training and the qualification of some staff to deal with the mental health problems, especially with regards to persons with disabilities, because I think that most of our staff lack such qualifications. Thank you, Mr. Amin, for this very specific recommendation related to the training of families, teachers, and all care providers who deal with persons with disabilities. Is Mr. Khalid Said with us, or do we still have some connection problems?
Can you hear me?
Yes. Please go ahead.
Could you please confirm that you are able to?
Yes, we hear you well.
All right, brilliant. Thank you very much. Thanks first everyone.
It's a pleasure to be with such distinguished panelists around and to see some familiar faces as well. So I think there are a couple of points I would like to make. The first is obviously that mental health and related problems are very common. You know, about 1 in 10 people would have a mental health problem at any given time. 1 in 4 would have a mental health problem across their lifetime. Given the current situation in the countries of this region, even before COVID-19, where more than half of the countries are experiencing chronic humanitarian emergencies, we know that the rates tend to double. If you look at the latest figures which we have published, around 22% of the people who have experienced adversity in the last 1 year would have a mental health problem ranging from mild to moderate to severe problems. But what's also important to remember is that people may not have a discrete mental disorder, but they would certainly be feeling distressed. And that's exactly what we are seeing during this COVID pandemic. That if you look at the rates of distress, they are extremely high as about 66 to 80% of the people in different countries, including in this region, are expressing being distressed. While the rates of mental disorders, again, are fairly high. If you look at some of the figures from this region, you would see that close to around 30% of the people are experiencing anxiety-related disorders, and around 18 to 22% are experiencing depressive illness kind of features. In addition, we know that services have been very badly impacted. If we look at the survey which we conducted last year, we saw that around 80 to 85% of the services were either completely or partially affected in case of mental health services, particularly services related to children and particularly services related to psychosocial interventions. Those were the ones which were the most affected services. But at the same time, what was positive was that almost all the countries developed technology-based interventions and tried to fill this gap. And almost all, as I said, that in most of the countries, either they moved to online consultations, hotlines were set up, platforms were developed, and so on. Now, I think what's important for us to remember is that mental health has always been a Cinderella sort of service within health services. We rarely get the amount of money or the resources, human resources, institutional resources, and so on. Just one small figure that less than 2% of the health budget goes to mental health, despite the huge burden. But this emergencies in general and COVID-19 emergency in particular have brought the issue of mental health and psychosocial support to the forefront. And that's why it's now up to us to make sure that the increased political attention which we are getting, increased technical attention which we are getting is actually translated into having more resources and having systems which are responsive to the needs of the population. And what I would suggest is that we need to focus on the broader developments which are taking place. One is universal healthcare. In almost all the countries in this region, universal healthcare packages and benefit packages are being developed and sort of being rolled out. So we need to make sure that mental health interventions are part and parcel of the universal healthcare interventions. Second, I think one of the important things is that we need to think of mental health as a dimension. So it should not be just about services. It should also be about how to promote mental health. And there are a number of evidence-based interventions which can be done. How to prevent mental health problems, and that's where interventions ranging from parenting skills training to school-based interventions, to work-based interventions are available, and they should be done. And at the same time, make sure that the mental health system is in place, ranging from interventions at the level of the community, which includes provision of basic needs, and at the same time involving community members. And that's extremely important. We tend to forget when we talk about professionally that the community members are resources. So they are not people who should be only recipients of care. They should be treated as partners. And they should be brought in, and their services and their capacities can be built up. And there are a number of tools available how to do that. Then obviously, if we just rely on services at the specialist level, we are never going to be able to provide the services needed. And that's where it's important that general health care and primary health care should have mental health as a complete component integrated into the daily service provision. But that obviously needs to be supported by specialist care, and that's why it's also important that specialist care should be strengthened at the same time. And importantly, this should be holistic in nature and with multidisciplinary in nature. It should not be relying only on psychiatrists or psychologists or social workers. It should be a team effort, and the specialist should support all the downstream services from community to primary care to general health care, and at the same time move away as much as possible from having dedicated institutions for mental health only to having mental health services available in general hospital setting as well. Because that would mean the access would be more, acceptability would be more. And lastly, the last point which I would like to make is that we in this region, almost all the countries have either ratified or are signatory to the UNCRPD. But if you look at the legislations which are there in the countries related to mental health and disabilities, often they are not in conformity with the provisions of UNCRPD. So I think it's also a good opportunity at this point in time to start advocating to review the existing legislations, update them, and bring them in line with the international best practices, keeping in mind that the voices of people whom we are sort of saying we are serving should be brought into the fold so that it really becomes all the stakeholders are on the same page. So I'll stop here and over to you.
ألف شكر دكتور خالد على هذه النقاط المحددة جدا. أكثر شيء
Thank you, Dr. Khalid, for these very important things. You have stated very important and maybe worrying figures related to the services provided to mental health problems. And we have as well stated very worrying figures about people who are affected by mental health or psychological problems. You have said very rightly as well that we should pay attention not only to persons suffering from mental health problems, but also to their family members and to the environment surrounding them. I am very glad that you have mentioned the CRPD. Of course, after this webinar, we need to communicate with you in order to elaborate further on all the points that you have raised. Mrs. Maha from the Higher Council of Kuwait for Human Rights. Good morning to all of you. Thank you for this very interesting webinar. And I think that it comes at a very appropriate time because now we're living in a pandemic, the end of which we cannot see for now. I do not want to repeat what has already been said regarding mental health. It's true that we need psychological treatment. Unfortunately, we are all ignoring a specific category, the category of informal workers or unskilled workers and the elderly who are mostly affected by the pandemic, because these unskilled workers are losing their jobs, and thus they do not have any economic means to survive. And we're ignoring as well the elderly, while this is a category that needs a high level of mental care. They are afraid. They do not know what the future hides for them. This is why I think that we need a universal program and not a regional or a country program. We need a universal program because this pandemic is a universal pandemic. The mental problems, psychological problems are common to all countries. So we need a universal program and policies in coordination with the governments and with the civil society organizations, because governments alone cannot develop any program without the support of civil society organizations. They have to work together. We need to talk about mental health on two parallel tracks. Our children need mental care, urgent mental care. Elderly need such care. Labor and workers need such mental care. Women need mental care, because we all know about violence against women and domestic violence in particular. We always say that women are care providers, but it is the responsibility of the society, of the family. Fathers have also a role to play in providing care to their children. Not only mothers, fathers have to play their role. They have to protect their children, to protect their wives, their sisters, their daughters. We need a universal program, as I said. We need to elaborate such policies, and this program should be elaborated now. We need to skip the bureaucracy that is prevailing all over the world now. Thank you. Mr. Brahim, we cannot hear Mr. Brahim. He's muted. Mr. Brahim is muted. You are right. We need to train families, and because of the pandemic established obstacles between the governments or the governmental institutions and the beneficiaries of mental health services. The private sector has to play a role, and if the civil society is not free in a country, the government will never be able to deal with the pandemic impacts and the effects. I would like to give the floor now to Mr. Hamza Shnebu. He is a specialist in remote psychological support. You have the floor, Mr. Hamza. Thank you, Mr. Ibrahim Salama. Thank you all for this very interesting and important webinar. On the basis of my field experience in the remote psychological support in the University of King Mohammed V in Morocco, I will tell you about how we established this remote unit. We need to think about such units, and we need to train the professionals in this regard. So through these services that we tried to provide, we were able to reach important conclusions. So we conducted a study on mental health, anxiety, depression, but I will move directly to the recommendations that we submitted. We need to think about the impacts of pandemic-19 as a longer-term impact. It means that we need more interaction, more webinars around this issue, and we need longer-term solutions. Of course, we are witnessing now impacts, but these impacts will go longer or will be seen on the longer term on children and on persons with disabilities, because now they are at home, they are not interacting with their peers. But of course, this psychological aspect could not be seen only as a luxury or as an attention given to a specific category. We need to think as well about the economic cost of mental difficulties. This is why we need a program in order to fill the gap at the level of mental health, especially in the developing countries, because we found that there are some indicators showing the vulnerability of these countries and these societies. This is why we have to think about such programs and about training of professionals able of providing these services. We need as well to reinforce our links with the universities in order to undertake academic research, as to have more specialized people who could deal with mental and psychological problems, because in some countries such specializations are quite inexistent in our university.
كلامك في منتهى كانت النتائج البعيدة المدى لم تعرف بعد.
Thank you very much. Now, we know that it is important to have a program that takes that into consideration. Most importantly, the tracking, intervention, and integration mechanisms based on the inputs of the different governmental entities. What are such systems and how to improve them amidst the pandemic? Mr. Muhammad Al-Halo. Good morning. Thank you very much. I'd like to thank you for the efforts made to have such a successful meeting. There is no doubt that the COVID-19 pandemic had left big repercussions and negative consequences in terms of the social, cultural, and political rights in general, in particular the mental health, the right to mental health. And we know that this pandemic had affected all different social categories: women, children, the elderly, people with disabilities, workers, patients, and even healthy persons. The health sector was a sector that that wasn't only affected by the pandemic, but it is the one that got extremely affected by the burden of this health. In Jordan, the hospitals and centers are being looked after in order to see what services are provided, and that is done through reports based on the different visits made to such medical facilities. In the last period of time, several comments and observations were identified, and in different countries we see different commonalities. We are all in agreement that the different health services now are targeting COVID-19 at the detriment of other healthcare services. Thousands of surgeries, medical surgeries, were postponed because of the COVID-19, and a lot of patients didn't go to the medical facilities anymore because of fear of the COVID-19. They think, for example, that such facilities might expose them to the virus. A lot of medical facilities stopped providing services, and hospitals were limited only to the urgent surgeries and medication to patients and old people. Some hospitals stopped receiving patients other than COVID-19 patients. The Ministry of Health, the private sector have done their best to follow up on the health situations of the mental health through mental guidance, mental support, and through services to the patients. However, the lockdown, the loss of jobs, the remote working and the remote education, the loss of different financial income, the capital due to the lockdown affecting the international markets have led to the increasing domestic violence, which increased this demand for services. We have the plan for 2018-2020, and Jordan now it's being assessed, and the plan for 2021-2026 is to be developed, and we hope that the crisis must be faced first through increasing the number of the specialized doctors and nurses in this mental health field, to increase the rehabilitation and equipping the workers in the mental health sector, especially with the new dimensions imposed by the COVID-19. We need to increase the coordination between the mental health service providers. Most importantly, we need to get rid of the stigma and the stereotyping of mental health patients, which can hinder access to services with the increasing number of patients. In addition to moving from the biosystem to the inclusive biosocial and human interventions, we need to increase electronic platforms to provide guidance and mental health services in this field. Thank you very much. Thanks a lot for this intervention and your great insights, sir. Now we give the floor to Dr. Ashraf Mir'i, the supervisor of the National Council for People with Disabilities in Egypt. The floor is yours, sir. Dr. Ashraf, can you hear me? While waiting for Dr. Ashraf, let me tell you that we still have a couple of minutes before we conclude, so we'll give the floor again to the keynote speakers with the same order, and I hope that your comments would be responding to what they're expecting and what's not properly happening from both the side of the governmental entities and non-governmental entities. What can be done differently, what can be improved based on all what was said and based on the suggestions that were direct and sometimes indirect in other interventions. Are you ready, sir? Or I start with Nahla. Dr. Ashraf. All right. And in all cases, when back, we'll give him the floor. Nahla, 2 or 3 minutes, please, if you can let us know what is needed, what must be done at the level of the UN or the national level. Nahla. Dr. Hind. We'll get back to Nahla later on. Thank you. Thank you, Ibrahim. I'd like to thank all of the speakers. I believe that this pandemic had put us in front of challenges. The entire world and countries have really realized the importance of mental health. What must be done and what is not done from the UN and the national countries. I think that in a crisis we cannot be able to recover overnight by asking for further support to mental health, because the question is how. Everyone spoke about the education, the formation, the training. So the mental health must be incorporated in the national policies in terms of the trainings, the framing, as well as the financial resources. If there are different partners that can intervene, and here we speak in particular about the civil society partners, those who largely work and indirectly work with the households, with the children in cases of disabilities or in other cases. Therefore, financial resources must be made available adequately, equipping the civil society with the necessary tools and resources. And here the states as well must allow adequate budgets. That is what the Human Rights Committee had asked for. General comments were put on this regard at the level of the CRC. And again, we cannot face this situation overnight. It must appear at the core heart of the interventions and policies of the countries. The UNICEF's director highlighted that the question of the mental health wasn't taken seriously before. 800,000 cases of suicide happen for children, and this year the report will be dedicated to the mental health. So everyone knows what needs to be done, but we need to take the appropriate measures and in order to really receive the support of the UN in this field. Thank you very much. Nahla, Ashraf, and Hola. Nahla, go ahead. Thank you, Ibrahim. I'm sorry. I don't know why I'm losing the microphone. Now that I'm unmuted, let me tell you that we need to take into consideration two levels of work. First, to limit what's happening now due to the pandemic, in parallel with national policies. I fully agree with Hind regarding the national level, but now there is an important responsibility. We need to limit what is happening with incorporating as much information as possible while engaging everyone, the communities, the households, the families, to prevent in order to avoid further deterioration because of the pandemic. Here, the UN has a role to play. The WHO and studies conducted in this field that are to a certain extent technical must be made really with easy access distributed to all stakeholders with a look on the economic and mental impact for the different mental and physical aspects. There must be also further interaction between the OHCHR and the WHO around the right to health in general and the right to mental health in order to support the treaty bodies that can provide recommendations, because there are lack of information cases. Information is not made available to everyone. They're only at the disposal of the experts, and that they must be mainstreamed on the long run. We need the national policies, resources for that, highlighting these important economic aspects and engaging the different stakeholders across the different pathways. The mental health issue used to always be covered by the super specialized entities. Yes, the specialization is important, but also mainstreaming the information in order to limit, for example, cases of suicide amongst the youth is important. That is something that not only specialized people must have access to it, but the family, people around the person who suffers from depression and frustrations might help overcome the crisis. So we have an urgent pathway and a long-term pathway. That's my perception. That's what I learned. Thank you for this enriching session. Thank you, Ibrahim. Thank you, Nahla, for this precision. Thank you for putting it into a pragmatic framework with different learning points. Dr. Ashraf, what can be done in your opinion? Unmute, sir, please. We cannot hear you. Unmute. In the name of God, the most compassionate, the most merciful, I am pleased to be with you in this special session with such a great speakers, with colleagues from Palestine. Because of the limited time, Dr. Amira from the Ministry of Health should have been with us today. I don't know why she couldn't make it, but it is important. It is important to highlight what the ministry had done in this field. Our culture in the Egyptian society, at least, shows that people with mental health or sick, we always have movies based on such stereotyped ideas, but the COVID-19 showed that we all need mental health support, not only mental health patients. And today we feel like we're really tied down. We cannot move around. And for people with disabilities, this is very important, because the people with mental health issues really have a lot of fears, suffer from physical and social situations that force them to we're sorry, Dr. Ashraf, you are disconnected. Obviously, Dr. Ola, what do you think? I'm sorry, Dr. Ashraf, you're back. Go ahead, please. The COVID-19 pandemic. You're breaking up, sir. We cannot hear you very well. I think it's because of the connection. While waiting for the proper connection, I give the floor to Dr. Ola. Hello, everyone. I second Dr. Nahla. as to the need for an urgent plan and a long-term plan. For the urgent matters, we need to see how countries can work together under the OHCHR's mandate in order to exchange and share good practices, how to support mental health aspects in the households with a lot of plans from the families and the households. We can see neglect, poverty, and violence, which affects the mental health of people with disabilities, namely children with disabilities who do not know how to communicate and how to have access to the proper assistance, how to help people with disabilities during the employment, how, for example, in the UAE, we've had the soft and flexible contracts and remote work for people with disabilities and others in the UAE to avoid the adverse effects of the pandemic. How to reinforce all of that in a different way for people with disabilities in a way that would guarantee their rights and their equality with others, to achieve accountability and to ensure equality amongst the different community members. An important aspect are the statistics. Current statistics, what are the main studies and comparative studies supported with research? Thank you very much. I'm sorry, Dr. Ola. Dr. Ashraf, very quickly, what can we learn from this? We've deployed efforts to communicate with people with disabilities around precautionary measures. Thousands of outlets were used at bus stations. Videos were developed with sign language, with subtitles to raise awareness. And all of that was developed by the Ministry of Health with sign language in order to ensure accessibility to everyone. The reduction of working hours, for example, allowing people with disabilities to come late or leave early so that they'd enjoy further flexibility. All of that was part of the system of 2018 that was reinforced to support people with disabilities and their families. I think that we shouldn't be only asking psychologists and psychiatrists to take over, but the families and communities must all be equipped with mental empowerment skills. It shouldn't be only people who have mental health issues who are supported, but we need solidarity amongst the community with a lot of people who can really support each other. We need to see how we can have information to have access to people with disabilities in such circumstances. Dr. Ashraf, you've spoken as well about the role of the civil society and its impact. Mr. Puras. Professor Puras, the floor is yours, sir. Your final thoughts.
I want to thank everyone for good interventions, and I would like to highlight resources and protective factors which always exist in families and communities. Just we have to empower, and we have to follow the principles I mentioned in my presentation, and to apply good messages, documents from United Nations and other organizations to apply locally, so that healthy cultural practices are supported, but not some harmful practices. So we can do a lot, for example, to educate parents nonviolent relations with upbringing of children, or educate everyone to engage in relationships which are based on and trust and respect. With regard to persons with disabilities, again, CRPD, as we know, did not create any new right, just it requires that persons with disabilities enjoy the same rights in community. And again, this is about empowerment and participation. So the COVID pandemic, of course, creates additional challenges, but also encourages us to be creative, to create solutions. And my observation from my former rapporteurship is that not necessarily Global North now is the leader in innovations, because there are so many good initiatives in Global South. And so all countries all member states are like in the stage of developing countries in the field of mental health, because this is the field which is emerging, and we have to just abandon discriminatory laws and practices which existed for many years with regard to persons with intellectual and psychosocial and other disabilities. This is possible with concerted efforts of state institutions, civil society, and mental health professionals. And medical model is not a bad model, but it was overused and CRPD conventions very rightly prioritizes human rights-based approach and social model, but this does not mean that the health sector has no role. It has some different role. So I want to thank all of you very much, and it was a pleasure to see that MENA region has a lot of opportunities to advance with modern approaches in the realization of the right to mental health. Thank you.
On the chat box for the participants, that will be useful. Thank you very much, Professor, for this. أستاذة سمية، لو كل ما قيل ينبغي أن يتكم على
Mrs. Sumaya, you are the member of the CRPD, and what can you suggest based on all what you've heard? You are the one who can sum it up all and wrap up. Thank you, sir. I have suggestions. First, to call governments to engage representatives of people with disabilities and their families, and the crisis and emergencies plans to engage women and people with disabilities in the national programs on women, security, and peace, to develop budgets based on indicators that ensure funding of services and requirements for people with disabilities. And I believe that now in the world and in our region, it's very important to modify regulations in order to acknowledge the legal eligibility and capacity of all of the peoples, especially people with mental and social issues, to develop programs for the family environment. Previous speakers highlighted families, and I think that the pandemic showed structural deficits at the level of the households and the incapacity of the families to acknowledge the rights of people with disabilities. We noted that all governmental and non-governmental programs focus on private organizations and care organizations, while the family environment is not equipped with the necessary tools, the education and the empowerment of the family members, so that they contribute to respecting the rights of people with special needs. And I think that we are in dire need of programs that cater for the family environment and that provide the appropriate and needed support to all different family members, and namely the women. Let me remind you that women with special needs and mothers or other people who cater for the people with special needs suffer from a dual discrimination, and that is something that's not well covered. The consequence discrimination prevents women from access to opportunities. And I think that the pandemic showed a digital gap, a digital divide that is very serious. Now, the digital mechanisms do have a role to play in breaking down the isolation around people with disabilities. Equality must be sought in terms of access to digitization. A while ago, Mrs. Hind Idrisi mentioned the official and formal studies and statistics that cover the COVID-19 impact on women and children, but it didn't take into consideration indicators around people with disabilities. I think that national centers and national statistics centers must have now work, formal, structured processes and sustained processes around the dimension of disability with the different gender, age, and type of disability components. The scientific studies, that's my last recommendation, the scientific studies on the disability and the pandemic. Sorry for the interruption. We will have the opportunity to work on the follow-up of this session for the CRDP together with you. The floor is yours, Dr. Abdel Hamid. Thank you very much for all of your insights. I think that the pandemic and the crisis response plans must be revisited. There are no specific mechanisms that hold countries bound to certain measures and actions. We have recommendations and no binding laws that countries around the globe comply to. And I think that the mental health cannot be affected in times of well-being and in times of crisis. In times of peace and well-being, the mental health is affected, and in times of crisis, it is the most affected. So this is unreasonable. We might accept that we have issues now, but even in times of well-being, it wasn't okay. So now, with regard to the health situations, this is very important. We still have a lot of complications around medications and inventions. We need to have simple language used, and we need to have a daily practice, daily program. That is the frontline protection for different crises, at least to reduce the potential adverse effects. We're speaking about mental support without a clear cut plans. We just have remarks. Even the person who mentions and talks is not a good believer. We still do not have mental health support. The specializations at the level of the experts with primary health centers, civil society organizations are still low. Skills in the mental health are very low. Training is not available, and if available, it has very limited tools, resources, no real professional practices that can be replicated. Thank you.
ربما من منطلق اشتد أزمة يدركوا أن
Thank you, Dr. Abdel Hamid. Maybe it's a good thing that we had this pandemic because we know now that we cannot ignore any more mental health. At the end, I would like to thank all the panelists and participants. I think that we were able to raise very important and fundamental points, and we will be collecting all your observations, all your conclusions. to put it all in a report that will be sent to you. At the end, I would like to thank our colleague Bahadina from our regional office in Beirut, as well as Mrs. Ruwaida Al-Hajj for all her efforts, Mrs. Reem as well in Geneva. And I would like to assure you that all of the points that you have raised would be collected and will be shared with you. It will be your ownership, and we will send you a general conclusion in order to see how we are moving in each and every crisis. The last word to you, Bahadina. Thank you, Mr. Ibrahim. I would like to thank all the participants who honored us today with their presence in this webinar. It was really very interesting. We have listened to diverse opinions and experiences from the Middle East and the North African region, in addition to experts from international treaties, as well as the former special rapporteur and two governmental organizations. We had a large number of participants from the Arab Maghreb and from the Middle East, from different backgrounds, like human organizations or human rights organizations, people working in the civil society, or in organizations for persons with disabilities. Of course, we will be summarizing all of these points and conclusions, and we will share with you the summary by email. Thank you once again. We have been honored by your presence. You had very valuable contributions. See you on another occasions. Thank you. And Ramadan Kareem as well.